Hi everyone, I am Anulakshmi from Chennai. I have been a severe asthmatic from childhood. So I have various experiences about asthma. So I have been to different stages of asthma from mild, moderate, severe to status asthma. That is why I wanted to start a channel especially for asthmatics. So this channel is called Ask and Know About Asthma, and here we will be discussing about various kind of issues related to asthma. It may be weather, it may be exercise, it may be not. We won't be discussing about a complete medical things and all that we can't do. Only a certified medical practitioner can do. So other than that, we'll be discussing a lot. So this is basically for asthmatics and all the caretakers of asthmatic patients. Okay, let's start the video. Okay, today we are going to talk about exercise. So exercise is important for everyone, isn't it? It's one of the main elements of daily life. But as an asthma patient, can I exercise? Or does exercising improve my stamina? Or it's going to increase my symptoms? So this all we have to going to see from now. So now let us see exercise in detail. There are several researchers done, and still they are researching a lot about asthma. Because of that, we are getting good medicines, and we are into the era of inhalers, rotocaps, and all those things. But there is one area that they've completely left. So that point is that the relationship between exercise or physical activity and asthma is still a case that is not solved. Have you all heard a term called exercise-induced asthma? Is there anything that happen after we do exercise? So these are the questions that will be always running through our mind and thoughts and all. Actually, during when you're doing an exercise, so what happens is your muscles tend to stretch, and we tighten some muscles. We do some kind of breathing exercise. All these things that you're doing is actually you're straining your body to become much more flexible. At that time, the exercise-induced asthma occurs. So how can we find the exercise-induced asthma? So we can find it by seeing the symptoms. So when you get an exercise-induced asthma, you normally you can see your nasal passages and your airways, which becomes swollen and inflamed, and you feel like something is squeezed between, and it's very narrow. All these symptoms tell you that you are having an exercise-induced asthma. We normally breathe in through our nose. But during exercise, when we are doing such a physical activity, we always tend to breathe in through our mouth. So the difference is the air inside our mouth is much more cooler and drier than the air inside our nose. So this is one of the main symptoms for an exercise-induced asthma attack. So when there is a person who has exercise-induced asthma, how can you find out the symptoms? It is very easy to find out the symptoms because they will be having a shortness in their breath, that is a breathing difficulty, nose kind of blocks kind of thing, and coughing, like that kind of coughing, dry coughing, or with a phlegm. And they will have kind of chest tightening, pain, and they will have the wheezing sound. You can hear the wheezing sound, and also there will be dizziness in this time. So that's how you can easily find the person who's suffering from exercise-induced asthma. It normally starts within the period of 5 to 10 minutes and easily gets worse. Condition becomes worse in the time of 10 to 15 minutes. So during that time, it's very important to be with that person, be their asthma friend, and also contact the emergency and do the necessary first aid, etc. Okay, what can we do when we see a person who's having an asthma attack, or even we are an asthmatic? So what can we do during exercise-induced asthma? So first, it is very easy. We have to stop the exercise that we are doing and just sit and relax. Then Take the asthma plan or the prescription which you always have with you during such kind of attacks. So always see that and see what all medications are prescribed, which are normally basically bronchodilators or relievers that will reduce your inflammation. So see that, and then take the inhalers also. Then again relax. Exercise should always be done at your own pace, your own level, especially when you have asthma. This will normally be decided by you and your doctor when you're meeting with the doctor or the respiratory nurse. They normally give you an action plan or type of exercises that you can do. Once you're exercising and when you're getting exercise induced asthma, what you should do is, as I already told, take rest. And once you're better, you can start doing your exercises. But we should be very sure that it's not going to attack again. So that is how you start. But after starting, if you get repeated kind of symptoms and the wheezing starts or the asthma starts to increase, you have to stop it immediately. Then you should definitely call the emergency helpline or your doctor's helpline, and then ask them to do what to do about it. What are the exercises that we can do if we have exercise induced asthma or even normal asthma? First one is called diaphragmatic breathing exercise, pursed lip breathing exercise, like that. Before that, get instruction from a proper instructor and do. Don't do it at your own pace, as long as how you like. So first one is diaphragmatic breathing. The second one is pursed lip breathing, and next one is slow nasal breathing exercise, which we also call as pranayama in Indian texts. Of course, everybody know which is the best exercise for asthma. Swimming, right? Okay. If you have a proper instructor and the instructor knows your condition, then go for a type of swimming that will ease you. And then yoga, as most of you do. Again, that is also very, very useful. We can go for a walking, slow walking, maybe medium walking if we can do. Medium walking. If it's possible, we can try that too. And we can also go biking, cycling, training, which is very, very, it's a very different concept, but it has some good effects too. So that the techniques are the main, there are only two techniques. The first one is called the Papworth method. The second one is called the Buteyko method. So with the help of proper trainers, you can attempt to do this exercise as well. How to prevent these asthma attacks? Yes, you can prevent it if you're very careful about what you're doing. First, you have to keep up with your daily exercise, and you would do your exercise daily, holistically, regularly. This is very important. And exercising normally can be done outdoors or indoors. Please check the weather and the condition before going outside. And if you want to go outside, please close your mouth and your nose with a scarf or with a small kind of a mask. So when you're going to do indoor exercise or do some weights, all those things. So then what is very important? We have to check the allergic uh, triggers that are inside our house and how much neat are we keeping the house. So, and we have to change our pillows regularly, of course, our bed sheets regularly, because that we are using every day. Okay, after all this, we are still asking ourselves, or asking others. I have moderate asthma. I have severe asthma. I have exercise-induced asthma. Can I still exercise? Yes, you can exercise. That is the answer. But with the consultation of your doctor and using your prescribed medicines every day, doing your daily activities. So, what doesn't after exercising? How do I feel, or what are the things that I'm achieving? Strengthening my lung function. This when you have good muscles and your lungs are in proper capacity, you can always inhale and exhale very easily. Next one is your immunity increases. So when you continuously exercise, there are a lot of chemicals which are inside the body, that will give you a lot of strength to your body and prevent you from getting into any major kind of diseases. Okay, the next one is weight loss. Of course, weight loss is very important for everyone, isn't it? So, during exercise, we tend to strengthen our muscles, lose our muscles, give a lot of activities to the muscles, and also breathing. So, normally, weight loss happens. Finally, this kind of exercises, it is basically all the breathing exercises and all the muscle stretching and weight exercises. All these exercises will give you a lot of stress-free life, improves your mood, and anxiety levels become very, very low. If you like the video, just click the like button. And also, if you want to inform this to your friends, kindly click the share button and share it. And also give me a lot of comments in the comment section, which will help me to improve this channel. We all can equally come and join and improve this channel. Other than that, if you want to see my other videos, I'll be leaving a link uh, below where you can click it and see. And please subscribe to this channel by clicking the subscribe icon and also the bell notification in that to get all my videos. Thank you so much for watching.